Welcome to this presentation, which has been made in celebration of BFI Ontario's 25th anniversary. My name is Marg LaSalle, and I'm a longtime member of BFI Ontario. I sit on the executive in the position of BFI Assessment Coordinator for BFI Ontario. I have no financial disclosure or conflicts of interest to report for this presentation. During this presentation, you will discover how BFI Ontario began, highlights of our journey over the past 25 years, both the main achievements and challenges we faced, factors currently impacting BFI Ontario, and then we will end the presentation with some plans on how all of us can guide BFI Ontario into the future. To understand how BFI Ontario came to be, it's helpful to look at both international and national events aimed at protecting, promoting, and supporting breastfeeding just prior to the year 2000. The Breastfeeding Committee for Canada, or BCC, that's our parent organization, was established in response to the United Nations World Summit for Children that took place in New York City in September 1990. At the World Summit, heads of state and government officials committed to a set of goals to improve the well-being of children throughout the world by the year 2000. Back in 1991-1992, the World Health Organization and UNICEF established the 10 Steps to Successful Breastfeeding and the Baby Friendly Hospital Initiative, or BFHI. In 1996, the Breastfeeding Committee for Canada became the national authority for the Baby Friendly Hospital Initiative and identified the BFHI as the primary strategy for the protection, promotion, and support of breastfeeding in Canada. The BCC did outreach across Canada to identify interested parties. The Ontario Public Health Promotion Work Group and the BFI Subcommittee were very interested, and they sponsored a stakeholder meeting in April of the year 2000. The meeting provided wonderful opportunity for discussion about breastfeeding and the BFI in Ontario, incentives and barriers to the development of a provincial strategy, and identified stakeholder support for the Baby Friendly Initiative to be established in the province. I remember Marilyn Saunders being the national coordinator for the BCC at the time. Linda Bumstead was chair of the Breastfeeding Promotion Work Group, and Jean Samuel was the co-chair of the OPHA BFI Subcommittee. Various organizations were present at the stakeholder meeting: RNAO, INFACT Canada, Ontario Society of Nutrition Professionals in Public Health, AWON, Canadian Pharmacists Association, Association of Ontario Midwives, VSUA, LaLeshlie Canada, UNICEF Canada, the Canadian Institute of Child Health, and various lactation consultant associations in the province. At the stakeholder meeting, the Ontario Breastfeeding Committee, or OBC, was born. A vision and mission for the organization were developed, and the people at the meeting began an action plan. In this slide on the right, you will see an early pamphlet that the OBC had, and on the front of the pamphlet is an illustration of the logo that we had. That was our first logo, which differs a little bit from the one that we now have. The next two slides show the main highlights of our journey in the early years. The first hospital in Ontario to achieve BFI designation was St. Joseph's Healthcare in Hamilton. That was in March of 2003. A few years earlier, in June of 1999, the first hospital in Canada achieved BFI designation, and that hospital was the hospital in Cowansville, Quebec. The Baby-Friendly Hospital Initiative evolved and expanded to community health services to reflect the continuum of care for breastfeeding families in Canada. At that time, there was a 7-point plan and guidelines to become a baby-friendly community health service. In 2006, the first community health service in Ontario achieved BFI designation, and it was Thunder Bay District Health Unit. In 2009, the Provincial Council for Maternal and Child Health led an expert panel to provide cost-effective recommendations to support the delivery of breastfeeding supports and services with a focus of improving breastfeeding rates. And then they created a document of recommendations for the provincial breastfeeding strategy for Ontario, and that was released in 2010. In 2011, Janet Bowie from our Ministry of Health and Long-Term Care worked closely with Kathy O'Grady and other members of the OBC Executive, and BFI designation became an indicator to measure public health unit performance. This is the accountability agreement. The Ministry of Health and Long-Term Care accountability agreements for 2011 to 2013 and 2014 to 2016 included BFI designation status as an indicator to measure public health unit performance for both the reproductive and child health standards of the Ontario Public Health Standards. These were very exciting times. Many public health units began to work diligently on implementing the 10 steps when the BFI was part of the accountability agreement. They collaborated with area partners, and there was a rise in hospitals working on BFI as well. In 2011, for example, there were 3 hospitals and 7 public health units that had achieved BFI designation. By 2018, there were 8 hospitals and 26 public health units that were BFI designated. In 2011, the Roger Hickson Ontario Human Milk Bank opened, and then in 2012, OBC decided to change the name to Baby Friendly Initiative Ontario to be more clearly identified with the Baby Friendly Initiative. Breastfeeding surveillance has always been an important component of the Baby Friendly Initiative, and in 2012, the Better Outcomes Registry and Network, or BORN, collaborated with BFI Ontario and incorporated the BCC definitions in hospital-based data collection. By 2016, each hospital in Ontario could use the BORN portal to access BFI reports about breastfeeding initiation, breastfeeding exclusivity at the time of discharge, supplementation rates, and so on. The BORN databases continue to be very helpful for hospitals. Breastfeeding surveillance in community health services is also crucial. From 2013 to 2015, York Region Public Health was the lead for a project funded by Public Health Ontario through the Locally Driven Collaborative Projects program. There were 36 public health units in Ontario at the time, and 27 collaborated on the infant feeding surveillance pilot study. A standardized tool and method for collecting infant feeding surveillance data were developed in the pilot. Then, after the original pilot, there was a follow-up project involving 7 health units that lasted from February 2016 till April 2017, and funding was from the Knowledge Translation Grant from Public Health Ontario's Locally Driven Collaborative Project program. The report from this is shown on the slide and is available on the Public Health Ontario website. The provincial government funded many programs aimed at protecting, promoting, and supporting breastfeeding from 2013 until 2019. In 2013, there was a government initiative called the Healthy Kids Strategy. The goal was to promote children's health and reduce childhood obesity from preconception through the early years. The Healthy Kids strategy was built around three main pillars: healthy start, healthy food, and healthy active communities. The Healthy Start component focused on supporting healthy pregnancies and early childhood development to lay a foundation for lifelong health. Through this component, a 24-hour telephone support for breastfeeding was launched. The BFI strategy for Ontario was born, and the strategy developed training, tools, and resources to help Ontario hospitals and community health services in their journey to achieve BFI designation, and targeted community-based supports for families with lower rates of breastfeeding were developed and funded through Best Start. In 2017, the medical officers of health and government officials discussed the inclusion of BFI designation in the accountability agreements, and it was decided that implementation of the Canadian BFI standards and BFI designation no longer be a requirement of the Ontario Public Health Standards. In 2018 to 2019, the BCC was awarded funding from the Public Health Agency of Canada to revitalize and expand implementation of the Baby Friendly Initiative to promote the health of birthing parents and infants in Canada and increase breastfeeding rates. The initial Quality Improvement Collaborative project was funded for 5 years, and the focus was hospitals. The hospitals that participated from Ontario were Mount Sinai Hospital in Toronto and Halton Health Care. The Ontario government ended funding of the BFI strategy for Ontario, and Best Start funding was not renewed in 2019. A year later, in 2020, Public Health Ontario released a Q&A document supporting BFI implementation, but not BFI designation or redesignation. Phase 2 of the BCC's Quality Improvement Collaborative project began in 2022. Ontario had 6 hospitals and 2 community health services that participated in this Coach Mentor program. In my role of BFI Assessment Coordinator for Ontario, I learned that many facilities were implementing some or all of the BFI 10 steps, but not seeking BFI designation or redesignation. From 2022 till 2024, the BFI Ontario Membership Recruitment Work Group did some outreach to attract new members to the organization. We also set in motion a plan to update the membership page on our BFI Ontario website. We continue to welcome new and returning members. We have always strived for a strong liaison with the Ontario government, and BFI Ontario has sent requests for government representation. Resources can become outdated, and we have noticed that this has happened with some of the resources that were developed by the BFI Strategy for Ontario and Best Start. We have updated the BFI Ontario website, and under the Family Forum heading on the website, we have some evidence-based resources that meet BFI standards. They are readily available to the public, and people don't need to have a BFI Ontario membership in order to access them. In 2024, the Breastfeeding Committee for Canada revised the assessment process for all facilities that are seeking BFI designation, and now the BFI recognition program has replaced pre-assessment. And then once a facility is ready, they can move to external assessment, which has been updated as well. BFI designation, however, still requires meeting the BFI standards for all 10 steps. The Breastfeeding Committee for Canada and the University of Manitoba recently received funding from the CIHR to support community health services across Canada working towards BFI designation. We have 3 facilities from Ontario that are participating in this project: Hanover Family Health Team, Black Creek Community Health Centre, and Northeastern Health Unit. This graph shows the number of BFI designated facilities in Ontario from the first one in 2003 until present. The blue represents hospitals, the orange is community health services, and the gray bar shows the total for both. 2017 was a very special year in that it was the year that we reached our peak. At that time, we had 8 hospitals and 31 community health services in the province that were BFI designated. Currently, there are 2 BFI designated facilities in Ontario. Bright Shores Health System, formerly Grey Bruce Health Services, achieved their initial BFI designation in September 2015 and were recently redesignated in June 2024. Carlington Community Health Centre, located in Ottawa, achieved BFI designation for the first time in December 2017, and they achieved BFI redesignation in May 2024. Guelph General Hospital, Sioux Lookout, and Sunnybrook Health Sciences have participated in the BCC's BFI recognition program, and all 3 of those hospitals have silver status, which means they have met the requirements for 6 to 8 of the 10 steps. The next 2 slides show information from Canada's breastfeeding dashboard that was updated in 2024. The data is from the 2022 Canadian Community Health Survey. Breastfeeding initiation in Canada has remained at 91% since 2017. The any breastfeeding rate at 6 months has increased to 69% in Canada, and the exclusive breastfeeding rate at 6 months has increased to 38%. In Ontario, the breastfeeding initiation rate has dropped a little to just over 89%. Our any breastfeeding rate at 6 months is up a bit, it's just over 67%, and our exclusive breastfeeding rate at 6 months has fallen a little to 35.3%. This slide gives a summary of the breastfeeding surveillance data for Ontario. Our breastfeeding initiation rate and exclusive breastfeeding rate at 6 months have fallen a little, but there are a few more babies receiving some breast milk at 6 months when compared to the 2017-2018 data. What concerns me, though, is that Ontario's breastfeeding initiation rate and rates of any and exclusive breastfeeding at 6 months are less than the rates for Canada as a whole, and I'm hoping that in Ontario we can improve our breastfeeding rates over time. I decided to take a moment to review the global breastfeeding targets for the year 2030. There's a target of 70% for breastfeeding initiation in the first hour. I know many of the hospitals and birthing centers in Canada are now measuring breastfeeding initiation in the first hour. Also, the exclusive breastfeeding rate for 6 months, the target for 2030 is 60%. The global target for breastfeeding at 1 year is 80% for 2030. Also, the global target for breastfeeding at 2 years is 60% by 2030. It certainly looks like Ontario and Canada as a whole have some work to do to achieve or at least get closer to these targets within the next 5 years. BFI Ontario and many healthcare facilities in Ontario are well aware that there has been a significant decline in BFI designated facilities in the province, and there are many contributing factors. Some of the factors are listed here, and you may know of others. Certainly, there have been many challenges over the past few years. It's important that we share with healthcare workers, government officials, and the public what research is telling us. BFI improves breastfeeding rates, and improved breastfeeding rates result in significant healthcare dollar savings. This slide gives you the link for a study that was done in Ontario by Sandra Hoy and colleagues. We have talked about this study in the past, and I know that the study is open access, so you can certainly take a look at it for the details. But the study showed that Ontario would save about $73 million US if we improved our exclusive breastfeeding rate at 6 months to 65%. That's pretty powerful, and I think it's a good goal that we should try to achieve. This slide provides an overview of national BFI supported work that's happening with the Breastfeeding Committee for Canada. As I mentioned earlier, the BCC received funding from the Public Health Agency of Canada for the National Baby Friendly Quality Improvement Collaborative Project, and 25 hospitals from across Canada participated in this. That was back in 2019. We had 4 hospitals from Ontario involved in this phase of the project. A little bit after that, in 2022, the BFI Coach Mentor program was launched, and this was a program for hospitals and community health services, and 6 facilities from Ontario were involved in this phase of the BCC national work. And then in 2025, the Breastfeeding Committee for Canada and University of Manitoba received Canadian Institutes of Health research funding to support community health services across Canada, working towards BFI designation. Ontario has 3 community health services participating in this Community Baby Friendly Initiative Collaborative, and that work began this fall and will continue into 2026 and 2027. The BFI Ontario Executive have started to build a wish list to provide the necessary support for families to achieve their feeding goals in the province. We know from the past that provincial government support can really help facilities implement the BFI 10 steps, work towards achieving BFI designation, and provide the supports around infant feeding that are needed by families in the province. BFI Ontario continues to seek a government representative for collaboration and representation at both BFI Ontario meetings and the BCC's Provincial Territorial Committee meetings. We know that it's crucial for families to receive factual information about infant feeding that's current and easily accessed. This is true for written and virtual resources, as well as one-to-one support when there is an infant feeding concern. Breastfeeding surveillance is key to monitoring breastfeeding trends, and the data can be used to improve breastfeeding rates and make them better align with the global targets that I talked about earlier in this presentation. Both hospitals and community health services can play a key role in capturing breastfeeding data. As we close 2025 and move into 2026, there is some important work that will carry on into next year. The Antenatal Hand Expression Work Group started earlier this year, and they will continue to meet, and their work will be shared with BFI Ontario members throughout next year. As I mentioned earlier, we have 3 community health services from Ontario participating in the Community BFI Collaborative, and their work will continue next year under the leadership of Emma Seeger, who is the project director. The BCC is involved in the World Breastfeeding Trends Initiative, and that work will involve BFI Ontario, and we will be looking at infant feeding data collection processes in the province And also, the World Breastfeeding Trends Initiative will be looking at Canada as a whole just to get an understanding of the infant feeding data and surveillance that is happening in the country and work that needs to be done. Also, in 2026, BFI Ontario is having a virtual event to celebrate our 25th anniversary and to help inform us on next steps as we move forward with an action plan. Our hope is that by working together, we can improve breastfeeding rates, improve the health of babies and families in Ontario, and save healthcare dollars. Thank you for your interest in BFI Ontario and your time for listening to this presentation. I really hope that you can become involved as BFI Ontario makes plans to protect, promote, and support breastfeeding through the Baby Friendly Initiative as we go into the future. Thank you so much.